everyone, my name is Danielle and today I'm going to be talking to you about the pathophysiology, epidemiology, and risk factors for Hashimoto's thyroiditis and Graves' disease. The thyroid gland is an important organ that plays a role in the metabolism of the human body. It helps to regulate breathing, heart rate, blood pressure, body temperature, and more. There are so many forms of thyroid disorders, but the most common are Hashimoto's thyroiditis and Graves' disease. Hashimoto's thyroiditis is the most common form of hypothyroidism and the most common cause of goiters. Over 10 million people in the United States have it. It is an autoimmune disease in which anti-thyroid antibodies destroy healthy thyroid tissue, causing chronic inflammation and overall decreased thyroid function. This also compromises the thyroid's ability to make enough hormones that the body needs. Levels of T3 and T4 hormones decrease, which leads to an increase in thyroid-stimulating hormone production. The increased level of TSH causes thyroid tissue to grow in the neck, which is what forms goiters. Risk factors for Hashimoto's include being a female, over the age of 40, having a family history of the disease, and radiation exposure. Graves' disease is another thyroid disorder that is caused by the overproduction and increased release of thyroid hormones. It is the most common form of hyperthyroidism. Graves' disease affects about 1 out of every 200 people. The immune system produces thyrotropin receptor antibodies that bind to receptors on thyroid cells, which stimulates them to overproduce TSH. That increased level of TSH then leads to an increase in T4 and sometimes T3. It's unknown why this happens, but there are many risk factors that contribute to its development. They include being a female, over the age of 40, having other autoimmune disorders, smoking cigarettes, and having high emotional or physical stress. That's not a good sign for all you stressed out nursing students.
Hello everyone, my name is Rose and today Athena is going to talk to you guys about the clinical presentations of Hashimoto's and Graves' disease.
The thyroid gland is responsible for secreting 3 hormones. These 3 hormones are thyroxine, known as T4, tridothyronine, known as T3, and calcitonin. T3 has a metabolic effect on the body. It affects the physiological process of growth, development, metabolism, heart rate, and temperature. T4 makes up 90% of thyroid hormones, and its function is to regulate digestion, heart and muscle function, as well as brain development and the maintenance of bones. Calcitonin is responsible for high circulating calcium levels in the body. Whenever calcium levels are high, calcitonin will decrease the levels by stopping calcium being transferred from the bones to the bloodstream, increasing calcium storage in the bones, and increasing renal excretion of calcium and phosphorus. Thyroid-stimulating hormone, known as TSH, targets the thyroid gland to stimulate the production and the release of these thyroid hormones and to control the growth and the function of the thyroid gland. In Graves' disease, a patient develops antibodies to TSH receptors, and these antibodies attack the receptors and stimulate the thyroid gland to release more T3 and T4. The release of the excess hormones leads to thyrotoxicosis, which can destroy the thyroid tissue and cause hyperthyroidism. Hashimoto's disease is caused by a breakdown of the thyroid tissue by antibodies. These antibodies destroy an enzyme called thyroid peroxidase, which is also known as TPO antibodies, and this enzyme plays an important role in the production of thyroid hormones. Hashimoto's disease is also an autoimmune disorder, and a blood test can usually confirm the presence of the antibodies.
Hi everyone, I'm Jeff Jackman, and unlike the rest of my group, I do not own a pet. So I am employing the help of my friend Saki, and we're going to be talking about clinical manifestations. So Saki, take it away.
Thank you for the intro. Clinical manifestations of Hashimoto's thyroiditis are extensive and fall under many different body systems like cardiovascular, neurological, and metabolic. Some of the symptoms include decreased force of contraction of the heart, anemia, weight gain, anorexia, intolerance to the cold, infertility issues, menstrual changes, brain fog, and lethargy. Clinical manifestations of Graves' disease oppose Hashimoto's. Symptoms include increased force of contraction, bounding pulse, weight loss, increased appetite, diarrhea, hair loss, brittle nails, nervousness, and intolerance to heat. One of the most notable signs of someone with advanced Graves' disease is bulging eyes, called Graves' ophthalmopathy.
Thank you, Saki. But how do we diagnose people with these diseases?
I'm glad you asked. Diagnosis of Hashimoto's disease includes both a hormone test and an antibody test. The hormone test will measure the levels of hormone production from the thyroid and pituitary gland. If the patient has low levels of thyroid hormone and elevated TSH at the same time, it shows that hypothyroidism is present. Furthermore, the blood test will confirm antibodies present in the body due to the disease being an autoimmune disorder. Antibodies against TPO, which plays a role in thyroid hormone production, may also help diagnose Hashimoto's.
I see. But can you tell me the diagnosis for Graves' disease as well?
Why, yes. The diagnosis for Graves' disease includes blood work, radioactive iodine uptake, ultrasound, and other imaging methods, like CT scan or MRI. Blood work will show lower levels of TSH and elevated thyroid hormone present. Iodine is needed for thyroid hormone production, and elevated rate of reabsorption will also indicate Graves' disease. Furthermore, an ultrasound of the thyroid may be implemented for patients who cannot undergo the radioactive iodine procedure and will present with an enlarged thyroid. CT and MRI will be implemented to observe enlargement of any extraocular muscles that are present in late-staged Graves' disease.
Thank you, my friend, for helping me out with the clinical manifestations and diagnosis of Hashimoto's and Graves' disease.
Hey class, Caesar here. So I just got done with my first 12-hour shift in the ER and I'm pretty tired, so I'm gonna go ahead and let my girlfriend's dog Grover tell you all about treatments for Hashimoto's and Graves' disease.
There are a number of ways in which Hashimoto's disease is treated. Since Hashimoto's disease is the leading cause of hypothyroidism, the gold standard for treating it is thyroid hormone replacement. Thyroid hormones come in either synthetic forms or porcine-derived. The most commonly used medication is levothyroxine, Synthroid, in oral form, which is synthetic. By adding thyroid hormones that are not being produced by thyroid gland, the patient's body is able to better regulate their metabolic rate, body temperature, blood volume, renal blood flow, and protein synthesis. The average dose varies with age and any comorbidities, particularly those with diabetes, but the standard dosage for adults less than 50 years of age is 100 to 200 micrograms per day. It's also important to note that patients with short bowel syndrome or those who are pregnant will likely need an increase in dosage by up to 30%. An example of porcine-derived thyroid used for Hashimoto's disease includes Armour thyroid. According to the American Thyroid Association, while looking at blood tests and psychometric test results of patients, there is no difference in thyroid function between Armour thyroid and levothyroxine. Less common forms of treatment include surgery, in which the thyroid gland is removed. A thyroidectomy is usually only done if the patient is still having persistent symptoms after thyroid hormone treatment. However, for those where surgery is indicated, it has been shown to increase overall health and reduce anti-TPO antibodies when compared to those who did not receive the surgery. In addition to thyroid hormone replacement and surgery, there are alternative or complementary non-pharmaceutical methods of treatment. For example, acupuncture, herbal medicines, and special diets. Herbal treatments for hypothyroidism include bladderwrack, gum-guggul, blue flag root, each of which have a different action to help treat the disease. These non-pharmacologic methods may help reduce thyroid antibody levels, which in turn can help the overall quality of life. Special diets such as autoimmune protocol diet, AIP, and gluten-free diets are known to help reduce systemic inflammation, which can help reduce the symptoms of hypothyroidism. For Graves' disease, medical therapies include the use of antithyroid, iodine, and beta blockers. The most common form of treatment for hypertension is radioactive iodine, although antithyroid medications are being used more and more due to the side effects associated with RAIs. As with any form of therapy, there are advantages and disadvantages to each. Beta blockers are used to help reduce some of the symptoms of Graves' disease, such as muscle spasms and heart palps. Surgical treatment is the same for Hashimoto's disease, which is a thyroidectomy or subtotal thyroidectomy, and the result is also the same. Alternative changes to reduce symptoms associated with Graves' disease include diet changes, which is avoiding salt, dairy, high amounts of animal proteins, taking L-carnitine, bungleweed, and lemon balm. However, it's important to note that evidence regarding the efficacy of carnitine, bungleweed, and lemon balm is lacking, and more research will need to be conducted for better understanding.
Hey everyone, I'm Crystal, this is Grey Cat, and today he's going to talk to you about some of the nursing disciplines involved in thyroid disorders, as well as the prognosis and some of the treatments that go with them. I hope you enjoy.
Hey guys, my name is Grey Cat, and today I am going to be continuing this discussion by talking to you all about the treatment and prognosis of thyroid disorders, specifically Hashimoto's and Graves' disease. I am also going to discuss some possible members of the care team that will help the patient manage and live with the disorders. Let's start with the care team, because patients heal faster when they have support. Research shows that the best method for managing thyroid disorders are pharmacologic therapy, a thyroid specialist, and surgeons in the case of thyroidectomy. The primary method of managing any thyroid disorder includes medication. Both Hashimoto's and Graves can be treated with thyroid medications such as Synthroid or Levoxyl. In the most serious cases, the patient may require surgery, referred to as a thyroidectomy. There are several kinds of thyroidectomy, and the one that the patient receives depends on the type and severity of the condition. This requires a surgeon. A third member of the care team would likely be the thyroid specialist. The patient will see the specialist to determine the severity of the condition and the care plan going forward. Being familiar with conditions specifically connected to the thyroid, he will become a key resource for the patient in managing his illness. Now, let's get to prognosis and treatment. We'll start with Hashimoto's. According to Medscape.com, Hashimoto's disease appears after age 6 and is more common in women than men. There was a study showing that out of 5,000 children, 1.3% received a diagnosis of Hashimoto's disease. In adults, the incidence is estimated to be 3.5 per 1,000 people per year in women and 0.8 per 1,000 people per year in men. This website also indicated that in a study done involving 25,852 adults, both male and female, 9.5% indicated elevated thyroid, and as before, women had a higher incidence than men. It was also determined that the prevalence of Hashimoto's tends to increase with age. This is an autoimmune condition, and therefore it cannot be prevented. However, with proper treatment, the overall prognosis is excellent. If not treated properly, it can worsen over time and lead to severe organ damage and other illness. Treatment for Hashimoto's consists of T4 or thyroxine, more commonly known as Synthroid, levothyroid, or Levoxyl. Moving on, let's get to Graves' disease. Like Hashimoto's, Graves is more prevalent in females than males. According to RareDiseases.org, the ratio is between 5 and 10 to 1, with incidences peaking around ages 40 to 60, though it has been known to affect children and the elderly as well. Overall, it can be found anywhere in the world and affects around 2 to 3% of the general population, making it the leading cause of hyperthyroidism. As far as treatment goes, there are plenty of treatments available for management, but as with other chronic disease, if not treated, it can lead to serious and possibly fatal conditions. Available treatment consists of antithyroid medication, radioactive iodine therapy, and or thyroid surgery. Thank you so much for listening, and I really hope you enjoyed my portion of the presentation.
Alright guys, that concludes our presentation, but let's go over some NCLEX questions. The nurse is educating her patient on what happens with her hormones due to her diagnosis of Hashimoto's thyroiditis. The nurse knows that the following hormones get decreased due to her disease process. Select all that apply. The correct answer is thyroxine T4 and tridothyronine T3. What are the main treatments for hyperthyroidism caused by Graves' disease? Select all that apply. The correct answers are radioactive iodine, full or partial thyroidectomy, and antithyroid medication. The most noticeable sign of advanced Graves' disease is... The correct answer is ophthalmopathy.
Now that we've gone over Hashimoto's thyroiditis and Graves' disease, does anyone have any questions?